Assalamu alaikum wa rahmatullah. Good day, guys. This is Dr. Muhammad Mursi. Actually, I have been asked by several colleagues regarding a specific topic that I'm going to discuss in the couple of seconds regarding lung fibrosis. Lung fibrosis. As you know, that lung fibrosis is one of the common topics encountered in the setting of the PACES exam and in the Irish clinical exam as well. And as you know that fibrosis can be classified into several categories. It could be classified according to the underlying cause into idiopathic and secondary causes, like rheumatoid arthritis, for example, or like medications. And these secondary causes require from doctors to do a biopsy to know the underlying cause behind it. On the other hand, lung fibrosis can be also classified into or using several classification methods. However, for the sake of the exam, lung fibrosis can be classified according to the location of the fibrosis into two main categories, as all of you know: upper zone fibrosis and lower zone fibrosis. So there are several causes of lung fibrosis, and all of them fall within these two categories, either upper lobe fibrosis or lower lobe fibrosis. So regarding the upper lobe fibrosis, you can use this mnemonic just to memorize or easily memorize the causes behind upper lobe fibrosis. You can use this mnemonic, CHARTIS. And regarding lower lobe fibrosis, you can use this mnemonic, DMAC. So let us start now with the causes of upper lobe fibrosis using this mnemonic, CHARTIS. So C stands for cool worker, pneumoconiosis. And H stands for histiocytosis. A stands for ankylosing spondylitis. R stands for radiation. T stands for tuberculosis. E stands for extrinsic allergic alveolitis. The first S stands for silicosis. And the last S stands for sarcoidosis. These are the main causes of upper lobe fibrosis. Now, coming to the causes of lower lobe fibrosis, you can use this mnemonic as I have told you, DMAC. D stands for drugs. And one of the most common drugs that can cause lower lobe fibrosis are amiodarone, methotrexate, and other medications as well, etc. M stands for most of the connective tissue disorders, with the exception of ankylosing spondylitis. And A stands for asbestosis. And finally, C stands for cryptogenic fibrosing alveolitis, and one of them is idiopathic pulmonary fibrosis. And actually, idiopathic pulmonary fibrosis is one of the most common chest cases encountered in the setting of the PACES exam, characterized usually the person with idiopathic pulmonary fibrosis will be a patient of more than 50 years of age with clubbing, and clubbing could be either in the upper limb or the lower limb, with bilateral fine inspiratory crackles, not changed with cough. And usually it doesn't need further biopsy. If the multidisciplinary team approach satisfies with the condition and satisfies with the core clinical context, usually lung biopsy is not needed in this case. Otherwise, secondary causes like autoimmune or medications, usually they require lung biopsy to know the reason behind lung fibrosis. So, to sum up, DMAC for the lower lobe fibrosis and CHARTES for the upper lobe fibrosis.